affordable, and available.
Thank you so much. Thank you so much, PS. The chief guest for today, His Excellency the Deputy President of the Republic of Kenya. Cabinet Secretary is present. PS is present. All the participants, once again, good afternoon. It gives me a lot of pleasure as the governor of this great county of Kericho to welcome you to this historic event. Indeed, today we are celebrating a huge milestone never witnessed in the history not only of Kenya but also in Africa as a whole. Your Excellency, I want to commit before your presence that being one of the good scholars around, Kenya is a pioneer on these directions we are taking on universal health coverage. Indeed, for a decade, Africa has been riddled with three issues. The biggest one has been poverty, the second one has been disease, and the third one has been ignorance. Disease is one of the biggest impediments towards achieving economic freedom in Africa as a whole. At the moment that we handle disease, the moment we look as a nation and as leadership into how we can deal with matters preventive and prevention right from the village level, it gives us the honor to move even a bigger milestone in terms of safeguarding the wealth of our nation. So many of our people have died in the past and across Africa, and the single reason is out of diseases that can easily or would have been easily prevented if they were diagnosed early. Today, Your Excellency, in your presence, we've been able to see the revolution that has been led by the Ministry of Health in terms of looking into the primary healthcare networks. And we were able to witness tremendous equipment of the universal healthcare promoters in the villages and how they were able to actually diagnose disease at that level and link them to the nearest dispensaries. As COG, we are committed to do our bit, and that includes equipping our dispensaries, our health centers within our locations and our villages so that we are able to assist. Once the community health promoters have diagnosed diseases, the patients would be able to get medication easily and in a more accessible manner. That is our commitment from the COG. Secondly, Your Excellency, we are committed as devolved units to ensure that we regularly stock our health facilities. Because one of the impediments is that, yes, we have diagnosed the patient, but when we revert to a facility and there is no medication, then it defeats the logic of the whole exercise. We are committed then as COG in partnership with KEMSA and other industries to ensure that we all the time and regularly stock our facilities in the villages. Because by stocking the dispensaries, by stocking the health centers, it then conceptualizes and make real the meaning of devolution, because services will be assessed right down in the villages. Lastly, Your Excellency, we are also committed as county governments to ensure that we provide ambulances in all our sub-county facilities and also within the health centers at the ward level, so that in case of referrals, then the patient is not again tasked with the pain of hiring taxis or vehicles, but we are able as government to support them to transport to the nearest facility. All this will sum up to speaking and giving voices to the vulnerable who would have actually lost their lives out of simple diseases that could be handled at that level. As I conclude, we have again witnessed today tremendous innovations that exist within our country. And I want to categorically speak out here that having gone around the pools that we have here, there is a clear demonstration that we have a sound innovation within our hospital facilities, private sector, and even research institute. Our ask as Kericho County is to enable us to also operationalize and run a research institute on cancer, because cancer is so much prevalent in South Rift, especially throat cancer. And we are going to be seeking partnership from the Ministry of Health and in your office to be able to actualize and have a vibrant research center for cancer. I wouldn't want to forget that today we've been able to launch an ICU center at Kapkatet. This was fully funded by the national government. And this is one of the rarest or one of the only ICU centers that we can have around level 4. This also goes a long way in aiding referrals so that you don't need to travel far distance to get ICU for patients. I'm glad to also announce that as a county government of Kericho, today we have an active side for production of oxygen. In the past, we used to go and purchase oxygen from Kisumu. And in the process, we could lose a patient in the process because of the distance. But today at Kapkatet Hospital and also at our referral in Kericho, we are producing sufficient oxygen to run the ICU facilities. Your Excellency, after this function, you will be creating for us one of our monumental achievements in office with this one here as Kericho County Government. We've been able to build a basic oncology unit, and we've been able to equip. This will speak on matters breast cancer, speak to matters of early screening that has been killing our people devastatingly. And you'll be glad today that you'll be able to launch for us that center so that it becomes operationalized going forward. Last, another list is that feel welcome, feel loved at Kericho County. Sample the best of this county. Make sure that you take tea, and we'll be able also to supply, mobile vendors of tea so that you sample the best of our tea. Around Kapkatet here, we have fresh food at a place here called Vienna. There you can get some quality nyamachoma, some quality isagek, which is alternative medicine, and also the only rare delicacy called mursik, Your Excellency. It is the only substance that is well brewed across the world. Even Europe has never discovered the science behind it. But we have the science here, Your Excellency. And we feel welcome that we partake of all this as we stay in Kericho. We look forward to having all of us at Mashujaa, and we want to thank you so much, dear Excellency Deputy President, for making Mashujaa happen in Kericho. Almost 90% of why we have this event today is because of your singular effort to push for it to happen. And we really want to appreciate your goodness and your grace for enabling it to happen. As usual, PS, we have a little problem. Permit me to introduce, I will not ask him to speak, the members of the County Assembly of Kericho County and the CCs that are here.
And your colleague.
And of course, I'll share 1 minute to him so that we proceed. So with your permission, I know the program, this is a state function, and we would have said so many other things, but this is a very tight time for a politician, because I ask God to work on my tongue so that whatever I say is seasoned and flavored to meet the occasion. And thank you, I've been guided by the Holy Spirit. So with that, I'd like just to introduce our members of the great County Assembly of Kericho, who through their efforts, they have made a success. Kindly stand where you are so that I just introduce you in the interest of the protocols of the program. We have our majority leader in the Assembly of Kericho, the Honorable Philip Rono. Asante sana, I know we'll have a time to speak when you are in Kericho. We have our host MCA, our good brother Amos Birir. Thank you so much, host MCA Birir. Asante sana. We have Mheshimiwa, we call him Broga, but he's a very good blogger. His name is, he comes from the Bosoni Quad. And we have Mheshimiwa Chepto from Bomet County, our neighboring county. We have the only elected woman MCA in Kericho County, Mheshimiwa Anita Ashandesana. We have Mheshimiwa Bafina, I think, from Kunya. Thank you so much. We also have Mheshimiwa Gabriela from Tebesonik, Asante sana. We have also Mheshimiwa Irene Chebet, who is the leader of Women Caucus in the Assembly, Asante sana. We have Mheshimiwa Etna from Belgut. Thank you so much for coming. We have Mheshimiwa Cheska from Litei. Thank you so much for coming. And we have Mheshimiwa, that is Nyesha from Bomet, and you are saying thank you so much. With that, you are tuko na aspiring women rep in Bomet County called Cherono. Makofi kwake. Asante sana Cherono. Utaongea baadaye asante. We have Mheshimiwa Philip Mesto. Thank you so much for being around, and God bless you. And we have Mheshimiwa Sirinjit from Jeborgei. Thank you so much and you are welcome. I also want and accept this. We have who? Oh, right here. We have where? Yeah? Bomet. Who? Thank you so much, Chief. We have Mashujaa Dominic from Kabianga Ward. Thank you so much for being around. We have the Chairman of Health. You will be having a session, a panel session to represent the whole assembly tomorrow. Mheshimiwa Maji, thank you so much and God bless you. We have our Vice Chairman in Health Committee, Mheshimiwa Moses. And we have our brother and one of the senior MCAs, Mheshimiwa Tarimbo, and God bless you. Hey, and the Speaker of the Assembly was here. I hadn't seen him. We have also our Speaker of the County of Assembly, Dr. Patrick Mutai, and you're welcome so much, my brother. Because of the unfairness of time, permit me, our brother, Excellency DG, just to also introduce you where you are, so that I will not be killed by this state function. You know, we'll say others already in Kericho. We have our lovely brother and our able Deputy Governor of Kericho, His Excellency Engineer Fred Kirui. Asante sana. Before I end, Your Excellency, just to share in my minute, I want to welcome Professor Barchok, our colleague Governor of Bomet, just to say one word. She wants to say one word, this hustler, and the upcoming women rep, so maybe...
President, Nanyon, karibu Kapkatet, naitwa Mayor kutoka Chebilat, and Branches MB na nato na kusimama hapa. President,